Hi everyone. Today we will learn the disease cervical spondylosis. This kind of disease is very popular in our medical clinic. Today I want to show you these items. First, we want to know what kind of disease is cervical spondylosis, and second, we want to the pathogenesis of these problems. Third, we can how to check up, how to exercise this disease. The fourth is classification, means what kind of how many types. The sixth is it's diagnosis, how to diagnose this problem, and the last one we come to how to treat this disease. So we see the first questions. So cervical spondylosis is a disorder in which there is an abnormal wear on the cartilage and the bones of the neck. Here's just simple ways. So this kind of change, what kind of change? It means the abnormal swell, can stimulate or oppress the local soft tissues, such as spinal cord, the nerves, arteries, then can cause a series of symptoms. Here, this change can stimulate in the first, not press first. Means what? Means that stimulate most of the problems just stimulate. Some few this is press. If you use press on the nerves or the spinal cord and the arteries, it's difficult to use Tuina manipulations. So we said if just stimulate, we can use Tuina. Okay. The third is what we call cervicogenic diseases. Means what? Some diseases, their problem is in the neck, but to show you it's not in neck. Maybe they said, "Oh, I'm a bit fast. Oh, I feel dizziness. I'm stomach pain, and so other problems." But you go to the Western doctor, check. They say, "No, your brain's okay. Your stomach's okay. No other things." But from our views, the root is in cervical, so we call them cervicogenic diseases. So those kind of problems we also include our cervical spondylosis. Here, one picture we say we can look transverse foramen. You see this is vertebrae artery. This is it's pass. So it's connect with the small brain, also to the brain. Yeah. You see, this is different parts. So this vertebrae artery algorithm, you can see here it's very narrow. You see, it's narrow, very narrow. Why here would be narrow? Maybe the stimulated by the muscles, or maybe pressed by the contract muscles. So stimulating here also can cause the vertebrae artery small or narrow. So this we call artery go to the internal ear and go to we call the brain. They can keep the body balance. If there's not enough blood go to that area, your balance will have problems. Here also the one picture for some neck muscles. So this muscles can hold the head. And also when you move, then these muscles should be movement. So these muscles also very important. So we call pathogenesis of these problems. We always say the internal cause or external cause. So internal cause, we say the osmolysis. This one is what we call on the flat roof of the cervical, sacrum. But the intervertebrate disc degeneration is the dominant ones. So degeneration, we know. So it's very important. Disc degeneration means what? Just like our hair. When the young people, the hair is for Chinese people is the black. Then when you grow up, then become white. So this we call the degeneration. This is it's a physiological ways, not the pathological ways. Okay. External cause means the acute injury. For example, you fell down, you're hit by something. So this we call acute injury. The second we call the chronic injury. So why acute or chronic injury can cause the problems? So because of what? Because of those areas can stimulate the nerves. Also sometimes we call them infrared the meridians. So how to check up? How to check up? First we will say X-ray. Normally we can X-ray. It's enough for the cervical spondylosis. But if we want to see the internal disc, then we can use CT or MRI. Or sometimes we want to see the arteries. You can use TCD, and also EMG. But EMG is a little bit pain, because this kind of checkup it's a little bit of pain. Also very expensive. Yeah. So classification, we call them types. So cervical spondylosis, we divide in 6 types. The first one is very common. We call the cervical radiocurvacy. Radiocurvacy means what? Every ends on my nerves root. Nerves root means the feeling difference. The pain. So the cervical radiocurvacy, this kind of cervical spondylosis, it's normally we say the feeling is different. Feeling change. Means what? You feel pain or you feel numbness, but the muscle power is no change. So sometimes we call them just stimulating the feeling, the nerves, feeling nerves. So it's very interesting. The second we call the cervical myelopathy. Myelopathy means what? You stimulate or press on the spinal cord. The third we call it sympathetic spondylosis. This kind of problems we also say always with other internal organs like heart, like stomach, or large intestine. You have problems, but the problems, the resource, it's from the cervical. And the vertebrate artery spondylosis is very popular for the middle-aged patients. Means what? The very important thing is this kind of problems, the patient always feel dizziness when they move their bodies. And the neck type, or we call the muscle type, just of the younger people, they always use one position for a long time, like with playing my computer or use cell phone. Those young people, they have neck problems. We call neck type the spondylosis. Neck spondylosis. The sixth it's very rare because of what we call the anterior vertebrae stimulating type. Those people, their feeling is from the throat. And if there are 2 types syndromes, we call them mixture. But normally, one is dominated. Okay. Now, how to diagnose the cervical spondylosis? Now we say it's from X-ray, and from the symptoms. Here you see, if the cervical radiculopathy, this kind of disease we call the pain. You see, dull pain, sharp pain in the back of the shoulder or neck, and also this pain can around the arm, even to my fingers. Fingers. You see, the upper limbs become weakness. So we can check if we have breast pain, and also do some taste is positive. And also X-ray can show. So this kind of eczema is more easy. Here I list some pictures. You see the spinal cord. Here is pressed by my disc. This can be called disc collapsion, disc herniation. So the intervertebrate disc, vertebrate cartilage, nuclear purpose fibrous rings. This means what? Means the disc collapse. And also here can cause limbs, numbness, pain, and burning feeling, and stiff and nerve power. And also can cause headache, dizziness. So this is we call the spinal cord is pressed. Okay, we can see. So there's other types we call the vertebrae artery type. Dizziness is the first, because of the body position change. The head, the dizziness will be strong, will be more severe. This is the taste. Okay, neck pain, just a muscle pain. It's easy. So here we say a mixture are always two types. More two types, but normally one is dominating. Okay. So how to treat the cervical spondylosis? Normally we use two ways. One we call the conservative treatments. Another one we call surgery treatment. So if we use a conservative treatment, the first choice is Tuina. It's from my view. So Tuina treats cervical spondylosis as the first choice. And the traction here, traction means what? The Western medicine doctor, they also can select the traction and to treat the cervical spondylosis. Third, we call it physical therapy and also acupuncture. Sometimes we call them medicines. This medicine we call Western medicine or Chinese medicine. Okay, both together. And if you use a conservative treatment, it's not works. Sometimes we can select surgery treatment. Surgery treatment. So if we use Tuina manipulations treat cervical spondylosis, normally we can select those points like GB20, DU14, GB21, or LI11, or SGF5. So and also AS points. And the manipulations include pushing with one finger, pressing, kneading, grasping, traction, and conditioning traction, rotating, shaking, etc., and so on. So this manipulation we can use. How to operate later I will show you. Now, this one we will call it how to operation. So this I divided 5 to 6 ways, steps. But from my view, we call 2 steps. First, just relax. Second, we call adjust. 2 ways. Here, I want to show you what kind of problems we can select surgery, because not all the cervical spondylosis we can cured by Tuina manipulations. So what kind of situation we can select surgery here? The first we call cervical myelopathy. This kind of is severe, not slightly. If not too severe, if slight problems, we also can use Tuina. But for severe cervical myelopathy, normally you should use operation or use surgery. Second, we call it acute injury. And the symptoms become severe and severe. Means what? After your treatment, not change. Here I mentioned the conservation treatment for half year and no good effect. And also the acute pain, and after treating 2 weeks, no change. The muscles along the upper limb, no power and shrink. So this kind of period of time, we should consider about to use surgery. So surgery, don't worry. Now the surgery is developed a lot, not like more 20 years ago. Cervical surgery is dangerous, but now it's more easy.